Patrik Rane is a final year Ph.D. candidate in the College of Pharmacy, Department of Pharmaceutical Health Outcomes and Policy. His advisor is Dr. Rajendra Apparasu. Patrik completed his bachelor's in pharmacy in Mumbai, India, and then has an MBA from London. Pratik's time is split between being a part-time analyst consultant for a pharmaceutical consulting firm and a full-time PhD student. Please allow me to present Patrik Rane to reveal the secrets of big data using an example of acid-reducing drugs.
Thank you, Dr. Patrik. At this time of the hour, I'm sure you would like to see this. Well, of course, with jalapenos. A spicy, juicy burger with some Cajun fries. We all love spicy food, right? With some jalapenos with them. And finally, we get this feeling of heartburn, dyspepsia, or the gastric acid reflux which pops into your throat and your mouth. But what do we do after this? We just walk into a pharmacy, consume some acid-reducing drugs, some antacids, for example, and we are done with it. But have we ever given a thought as to what kind of antacids or what kind of acid reducers we should be consuming? Well, to start with, there are about 3 types of acid-reducing drugs, starting with a low-potent antacids to a moderately potent H2 antagonist, and thirdly, a very highly potent proton pump inhibitor. Let's focus on the proton pump inhibitors, which are also called as PPIs. PPIs are basically recommended by the FDA for certain indications or certain diseases, like gastric ulcer, which is your stomach ulcer, intestinal ulcers, or gastric acid reflux disease, wherein the acid from your stomach regurgitates into your mouth and that odd feeling. These are mainly the indications for which these drugs are being indicated. However, literature suggests that about 82% of PPI consumption is without a proper indication, which means out of the 100 people sitting here and consuming PPIs, 82 among you are taking the drugs without a proper indication. There is no proper need to take such a drug. FDA also suggests that these drugs, that is PPI, should be taken for a maximum of about 8 weeks. But again, the literature suggests that these drugs have been taken continuously for about 2 to 4 years. Now that's a very long duration. These drugs have a benefit of having very low side effects, to start with dizziness or constipation. Recent studies also suggest that these drugs, if taken for a longer duration, they cause infections like pneumonia or continuous diarrheal infections leading to death. Even fractures has been seen in patients consuming PPIs for a longer duration. In fact, FDA itself have marked on their labels for a risk of fracture if you consume a PPI for a longer duration. Certain rat experiments have been conducted wherein they found that if a rat is forcefully given PPIs for a longer duration, gastric cancer can occur in rats. Not here to scare you, but these experiments have not been proved right in humans as of now. The conditions worsen in an elderly population. So when a patient ages, or any individual ages as the age increases, his immunity goes on decreasing. He is more and more prone to infections. There is higher tendency of him getting a fracture. There are many comorbidities associated with age. An individual is taking many drugs at the same time, which is making him more prone to infections. Imagine if such a high potent PPI is given to an elderly patient, it will definitely increase their chances of getting an infection. So is there a way to find out the reasons why such PPIs or highly potent proton pump inhibitors are given to patients? Is it your age which is forcing you to take these medications inappropriately? Or is it because you belong to a specific race, you are taking these medications wrongly? Or is it the other medications you're taking which is causing you to take PPIs for a longer duration and in a wrong manner, that is without an indication. It would be amazing to find out a method wherein we could find out these reasons or the factors which lead to inappropriate PPI prescription. Fortunately, there is. We can look at large healthcare databases, at different patient profiles, and see what kind of medications they are taking, what kind of diseases do they have, and design studies around them. A similar study was conducted here at the University of Houston, wherein we looked at the national nursing home surveys among the elderly patients, and we found out the factors for inappropriate prescription of PPIs. What we found out was that patients with osteoporosis had a lower likelihood of being prescribed a PPI. If you are coughing chronically for a longer duration, you are being more likely to be prescribed a PPI even though you do not have an indication for the drug. And thirdly, if you're taking antidepressants, you are less likely to be prescribed a PPI. So this is giving us a reason as to why and in what conditions PPI are being prescribed. So wouldn't it be amazing to know if I have this condition, I'm not supposed to take PPIs for a longer duration? So these are the reasons which are useful to know beforehand. What would a patient do with it? He would be more cautious when consuming PPIs or a highly potent acid-reducing drug if he has such a condition. A physician would be more cautious when prescribing such medications to patients with osteoporosis or some patients with chronic cough. And last but not the least, it would also help the manufacturers of the drug to put on their labels that if you consume this drug, you are at an ill effect of getting an infection or a fracture or any other outcome for that matter. So the moral of the story is stop popping drugs every now and then and look at the reason why they are being prescribed for. This is how we intend to generate evidence here at the University of Houston and help the community. Thank you so much.